Hello everyone, I'm Dr. Ken Freedman, President of the East Brunswick Advisory Health Council, and we have a special edition of the Advisory Health Council's Wellness Spotlight. These days, nearly every news broadcast includes the latest reports on coronavirus. Public reactions range widely from not taking it seriously to the fear that we're on the brink of the next pandemic. What should we think? Today on Wellness Spotlight, we have a panel of distinguished experts to help us separate help from hype. Tracy Zivin-Tutela, MD, is a board-certified infectious diseases specialist. Dr. Zivin-Tutela is the owner and director of Infectious Disease Specialists of New Jersey. After graduating from East Carolina University with a Bachelor of Science in Biology, she went to Saba University School of Medicine, earning her Doctorate of Medicine. She completed a residency in internal medicine at UMDNJ Morristown Medical Center in Morristown, New Jersey. She continued her training in New York City, where she did her fellowship in infectious diseases at Columbia University, St. Luke's Roosevelt Hospital Center. After completion of her training, Dr. Zivin-Tutela practiced infectious diseases in Manhattan for 10 years. During this time, she was the medical director of Westside Infectious Diseases, as well as director of transplant infectious diseases at St. Luke's Roosevelt Hospital Center. She currently practices in New Jersey, caring for patients in general infectious diseases, as well as hyperbaric and wound care medicine. She's been featured in numerous media venues, including NBC Nightly News, Dr. Oz Show, Good Morning America, as well as Parenting Magazine and the New York Daily News. She was named Super Doctors Rising Star New York, along with New Jersey Monthly's Top Doctors 2019. Lester Jones is the Middlesex County Health Officer and Director of the Office of Health Services within the Department of Public Safety and Health. He has served in this capacity since January of 2012 and has utilized his 35 years of experience in public health and environmental management to enhance public health programs within the county. Prior to working as the Middlesex County Health Officer, Mr. Jones was the County Health Officer for Union County, New Jersey. He had the opportunity to build public health response to all hazards, emergencies, and environmental regulation and enforcement programs within the county. He continued a focus on building collaboration and resiliency among public health, emergency management, and community partners. Austin C. Kosik Jr., the gentleman that we know commonly as John Kosik, CEM, has worked for the Township of East Brunswick for 37 years as the Emergency Management Coordinator. He's brought forth many public safety initiatives, including the Special Needs Registry and Mass Calling Notification System. Austin has a BA from Seton Hall University and in 1995 achieved the designation as a Certified Emergency Manager. During his tenure with the Township, he has managed 15 presidential disaster declarations, including response to West Nile virus, September 11, 2001 attacks, and Hurricanes Katrina, Irene, and Sandy. John has been a member of the East Brunswick Board of Education Safety Committee since its inception and co-authored the original school safety and security plans. He actively participates with training, exercising, and updating of the plans. In 2009, Austin was the principal planner for the H1N1 vaccination program within the school district. Austin has been appointed to various county, state, and federal task forces. He has authored and published writings in the field of emergency management and served on numerous planning and technical committees. Thank you to all of you for taking time out of what I know is your very busy schedules to be here with us tonight. Dr. Zivin-Tutela, let's begin with you. Could you tell our viewers what the difference is between a bacteria and a virus?
Sure. So a bacteria typically is a type of infection that we get that can be easily treated with antibiotics. A viral infection is more commonly the common cold or the flu, or as we're speaking about today, coronavirus, and those unfortunately don't have an antibiotic, or in this case, coronavirus does not have an antiviral to treat with. But in general, most viral infections cannot be treated with an antibiotic.
And what do we need to know about coronavirus?
Sure. So we can start with that we know it started in China. How it started, we're not 100% sure. The thing that's important for the public to know and why we've heard so much about it is it's a new virus. Our bodies have never seen this virus. That means we don't have antibodies to kind of fight it off. So the flu, even though it's a little bit different every year, we have some antibodies to it. So, we have a little bit of fight in us.
There's no natural immunity to it.
Right. So we have no natural immunity to coronavirus, and it came from an animal. So we know that that makes a more severe infection than something our body has already been recognized.
Is there any idea of how it originated?
There's some thoughts, but we don't know truly how it originated. We suspect it's come from an animal source, but we don't know exactly.
I had heard things like diet was related. People were eating bats and rats and things that we don't even think about consuming here. Is that reasonable to assume it could have been contracted this way?
Yeah, so that is one of the theories. We don't have enough evidence to say this was definitely from a bat or from a different animal, but we suspect, based on the early cases, and that it did come from an animal source. Trying to narrow down which one, we're not 100% sure yet.
So it would be the handling of the animal, not the ingestion of it, that would do it? Because wouldn't the gastric juices kill the virus in the body?
So depending how you're ingesting. So if you're cooking something, yes, it would kill a virus. Gastric juices tend to kill most viruses, but some very strong viruses, I'll use the word, can withstand either not full boiling or full cooking all the way through, and can bypass some of the gastric juices. So we're not really sure if it's handling alone, if it's inhalation of, from the animal, or actually eating.
Now, since coronavirus is primarily in China, even though there have been many other places around the world, but mainly in China, why should we be concerned over here?
Right, so 99% of the cases have been in China, and I think that's the comforting kind of comforting thing to put in front of the audience, is that 99% cases the cases that have been outside of China have been from people who have traveled through China or had contact with someone in China. So the reason why we should be concerned here in the US is that, with global travel, everybody's one step away from being from another country or having exposure to another country.
What should a person do if they think they've been exposed?
The most important thing to do, if you think you've been exposed either from travel or from somebody who has traveled to the region or someone who is known to be sick, is to call your physician, your doctor, and stay at home. The doctor will then activate other resources within the county and the town, and decide whether testing at home and self-quarantining or admission to a hospital is warranted.
Now, there are many people who have gotten the flu this season. How would a person know whether, if they had the flu, whether it would be a coronavirus infection or something else?
So the symptoms are very similar. Fever, cough, shortness of breath, all fairly similar this time of season. The difference would be the travel history or exposure in an airport out of the country or exposure to another person. How
would a person protect themselves from coronavirus?
So the most important thing we say is hand washing. So it's transmissible from droplet, which is about a 6-foot distance from someone coughing, sneezing, so on and so forth. There is some new data saying maybe it lasts a few hours on a surface, like a tabletop. But the most important thing to do is hand washing. 20 seconds, soap and water. If you don't have soap and water, alcohol, hand sanitizer would be the next step with at least 60% alcohol. Reminding people to cover their nose and their mouth when they're coughing or sneezing, and not traveling to certain areas that we know have the virus right now.
Very interesting. I've seen people wearing masks to protect themselves. Do they offer any benefit?
No. So the masks that most people are walking around or that are selling out of big box stores are not the masks that are actually going to protect you from the virus. There's special masks that we use in a hospital setting that are not very comfortable, and you're not going to want to wear for hours and hours and even a day because they're super uncomfortable, but they will protect you. So the everyday masks actually don't really give you no benefit whatsoever, and hand washing is actually much better to protect yourself.
Does exposure to coronavirus automatically mean infection?
So we know there have been some patients that have not had a very mild illness. So we have seen a few that have had mild illness, and obviously we've seen the spectrum all the way to, unfortunately, people, being severely infected. We know that we can't trace exactly why right now. We can't predict who's going to have a mild form. In general, it's been a more severe illness than most other viruses we're seeing, and that's because we don't have natural immunity. Like
with the flu, are young people and much older people more subject and susceptible to infection?
The young and the old and those who have other comorbidities such as diabetes or cancer, some other medical problems are definitely at a higher risk.
Anyone who's immunosuppressed?
Correct.
Les, what is the county doing to be able to help us?
Well, we've been monitoring coronavirus since December, when it started. So we've been following our partners at the CDC and at the state. As we mentioned, we have flu. Coronavirus, very similar to flu. So we've been through other types of scenarios with flu. We've had H1N1 and other things that we've responded to in the past. So we've pulled those plans out. We pulled our plan for flu out and basically have taken a look at that. We've updated it. We've been in contact with our partners right away, the hospitals, our infectious disease docs, our infectious disease practitioners in each of the hospitals. We were immediately in contact with them, make sure that they were aware we're still here. We're usually in contact with them anyway for many other things and other diseases that we deal with on a regular basis. So we're in contact with them, make sure they had our number. If you see something come in, please contact us right away. And we've been in contact with our state, state health department partners as well. We've been getting information out. We're a conduit of information. We have a lot of partners, partners with our emergency management folks and whatnot that are out there. So basically we're getting all the information out there. There's different guidance. We've been answering calls from schools. What do? I had someone who just recently returned from China and now they're in my school. What do we do? So the CDC has put out guidance for schools, K through 12, for preschools. They put out guidance for colleges and universities. We were in contact with Rutgers University immediately after this happened because we knew they were either going on spring break or returning from spring break in the middle of January. So we were in contact with all the leadership of the health centers through the university, and we actually have weekly conference calls with them now to make sure that everybody's on the same page, that we're responding. So we've had some instances where people have traveled, they become ill, they've come into the health centers, they've been tested for flu, number one, because it's a ready test that we have and we can identify what flu virus it is. And then if it's necessary to have testing done for coronavirus through the state health department, those samples were being sent originally down to the CDC labs, but now that has progressed and more of the state labs have been given the means to do the testing. So we get testing done a lot faster. So basically the main thing is communicating and being on shows like this, getting information out to the public. We've had information put out on Facebook, on Twitter, on Instagram, so people follow Middlesex County. Through those means, they will get updated information that we put out. We also have a coronavirus page on our Office of Health Services website, which if people go to www.middlesexcountynj.gov and they search for coronavirus or the Office of Health Services, they can get to our page. And we have a page dedicated with the latest guidelines. In the beginning, we were updating that page sometimes 3 and 4 times a day because information was changing so fast. I think last week things kind of leveled off a little bit, so it's been a couple times a day we've changed it. But as soon as we get information, either from State Health Department or CDC, we put that information right up on the website. People can also, if they have questions, the Poison Control and Information Center has partnered with the State Health Department and all the local health departments across the state. They can contact the Poison Control Center and call them if they have questions. The number there is 1-800-222-1222. And that's staffed 24 hours a day. So if they have any questions, they can contact them. Basically, it's communications right now. We're also very heavily monitoring as people do travel back to the United States. They're going through one of the airports that have a U.S. Public Health Service quarantine station. As they come back, their travel history is they take a look at that. They record the people, they take a temperature there, they check to see if they have any symptoms of any illness at the time. And what they do, the CDC does, is they communicate that information to each of the states. The state loads that information to a communicable disease registry that every county has access to. And we check that on a daily basis, and we get notified of people who have traveled with coronavirus. We contact those people. Obviously, we educate them on what they need to do if they become symptomatic. We also monitor them from that point on. We assess their risk depending upon their travel and depending upon their state of health at the time. And we monitor them from anywhere from 7 to 14 days, and 14 days being the incubation period of the disease. So we've been doing that. We have a very diverse population in the county, so we do have a lot of people who do travel back and forth from China and from some of the countries that have been affected.
Les, have there been any confirmed cases within the county or within the state of coronavirus?
At this time, as of the taping, there are no cases of confirmed cases of coronavirus in the state of New Jersey.
Now, what about around the country?
So around the country, currently there are 15 confirmed cases in 7 states across the country. There are no deaths, okay? If you look at it globally, in China, there's over 74,000 confirmed cases of coronavirus and over 2,000 deaths associated with it. If you look outside of China, there's over 900 confirmed cases in 25 countries, and there have been 3 deaths associated with it. So.
In viewing some of the experts on television, they're questioning whether the numbers coming out of China are really accurate. They think that they're playing down those numbers, that it's really much worse. And we're seeing now that a number of healthcare workers in China, frontline healthcare workers, have died as a result of exposure to coronavirus. That's how serious it is. Yes. I just wanted to acknowledge the Middlesex County Office of Health Services, and especially you, Les, and your terrific team for all the great work that you do and all the resources that you have available to us to help keep us healthy and protect us.
Thank you.
Thank you. So, speaking of emergency management, John.
Yes, here we are, local level.
You're the protector of the town.
Well, not quite the protector. I'm the preparedness coordinator.
You're the preparedness coordinator, but yes. You're in charge if anything happens, isn't that right?
Yeah. So our plan is all hazards. So a lot of it's referred to as storms and hurricanes and things. But actually, the most part of our plan has been practiced the most has been our health annex, with our annual vaccinations for flu, and we've done programs regarding West Nile back in 2000, H1N1.
H1N1.
We did bird flu. We had a bird flu plan, so we're ready. If this virus happens to come over into the United States, New Jersey, Middlesex County, East Brunswick, we have a plan. We'll exercise that plan at any given moment. This is nice how we're set up because it starts at the top, at the doctor's level, infectious disease. They break it down, they get it to the health department under Director Jones, and then we get it. And then we work from the bottom up to give them our information. So we're ready to go. One thing I like to let the public know is get your information from a trusted source. There's so many sources out there that are just not giving the right information.
Where would be some trusted sources?
So the websites that Director Jones has mentioned, The World Health Organization is another site you can go to. If you link into any of the township websites, you can link down to emergency management. We have those links on there for people. They're trusted sources. There's a lot of problems out there that we hear coming into us from people making things up. Just some really silly information. Enjoy your Chinese food, okay? Enjoy it. It's fine, all right? Please. There's just so much going on out there. You mentioned about the economy. Right now, we're in good shape. We have a plan. Whatever should take place, we're going to respond to that plan immediately. In the event we have somebody come back from a trip and they call our 911 system, there's a vetting information source that our police dispatch, from the immediate call you call us, will ask questions through our emergency medical dispatch protocol. If it meets a certain protocol, now the responders have a certain protocol for that person.
So if somebody suspects that they're exposed or they may have contracted it, what number do they call?
Well, if they're going to call 911 because they're not feeling well, they want to go to the hospital, there will be a list of questions the emergency medical dispatcher will ask. There's certain flags in those questions. If they pop up, we have a different response protocol. We've done this before. When there was the potential Ebola, we've had that and we've responded accordingly.
Now, the response is through public safety or through?
It's a combination between public safety, our hospital system, our health department, and it's a coordinated response that's in a plan that we've practiced and actually deployed before in East Brunswick, because people hit certain numbers for different types of diseases, and we do that. Again, trusted source, get your information from a trusted source, and just be at ease that we're prepared to do this. We've done this before. Our plan is on the shelf, updated continuously, and in the event it hits our town, we're in good shape. If we have to do vaccinations, we'll have vaccination clinics. If we need to get into schools, we've done that. We do it again. We did it in 2009, 2010. We conducted a vaccination program inside the Brunswick Square Mall in 2010, where we did vaccinations for almost 4,000 people, 3,968 during a day in a vacant storefront. We can do this. We've done this. There's no need for any panic. There's no need for any, this is not going to work. This will work. If we need to do pills, if the doctor feels we need to give an oral pill, we have a plan that you can come get pills from us. We have it all ready to go. It's calmness, it's preparedness, and trusted sources, as we're doing here. Get it from a vetted source that you're good to listening, and you've gotten it over the years, good information.
Well, my understanding is at this point right now, there is no treatment for this.
Currently, there's no treatment, but there's active research going on right now within China of trying a combination of different antiviral medications. That is being done, and that is being monitored by Infectious Disease Society, WHO, CDC, and they are trialing some different antivirals. So that may change at any point. That could change by the time we're done taping this, could change in a week or two. So we don't, at this moment, have a treatment other than supportive care, but there are a lot of different antiviral medications that are being tried in China to see if they have benefit.
Thank you. John, workers in China, frontline workers, have died from exposure. Is there also a plan to protect the frontline workers in the United States should an outbreak take place?
Yes, so there are, let me just slide back real quick. We share a lot of information on a regular basis, daily basis, sometimes bi-daily, sometimes hourly. As we've gotten closer to certain incidents that have been going on, there's a lot of information sharing. If hospitals see a surge, health department gets it, they get it to us. If we're seeing something that's not going right in our schools or in our large businesses, we'll get it to the health department, they'll get it up to the hospitals. So there's a lot of information sharing that goes on, and I'm very confident that if something should happen, we can respond to it. In the event workers need protective equipment, if we have it falls into a hazard materials at that particular point, whether it's chem, bio, man-made, whatever the case it is, there's protective equipment. The mask we had talked about, we can get those masks at a very quick time and get them out to workers. Protective suits, gloves, masks, suits that they would need. We have that. We've practiced that plan. Be assured that in the event it should happen, we can do this. There's no fear whatsoever. we can get it done.
This is not the first time we've ever had a situation like this before in East Brunswick, is it, John?
No, it is not. As I alluded to a little bit earlier, 2009, 2010, the H1N1, once that vaccination became available, it was quite the undertaking for the municipalities in the county, through the health department, through the state, through the CDC. See how it works down? Federal, state, county, bottom, then bottom up. We enacted our vaccination plan, and we actually did vaccinations in our school system. Almost 4,000 students and staff, we were able to do the vaccinations. We did the Brunswick Square Mall. I think the county did 12 other additional sites throughout Middlesex County that did a very good advertising, very good mass media through our Nixle system. I encourage everybody to sign up for Nixle. I encourage everybody to use text messaging, the phone end of it, the web end of it, because we get this information out and we all partner up together. So they have the flu county vaccination plan, and I think as we move forward, what I'm seeing is you're seeing these pharmaceuticals, CVS's, Walgreens, Rite Aids, starting to do certain more medical. I can see down the road that they're going to become a trusted source, that if something was to come out, we can make arrangements for them to do this.
Does this situation present any unique problems for the Township of East Brunswick,
No,
John?
no. We have a plan. We're solid. We information share. We have time. This is leading up. Very similar to a hurricane. Hurricane just doesn't show up. We see it march across the body of water, and all of a sudden, we're ready to go. Same thing with this. We've been watching it since December. Our office, every day, we're checking the website. We're checking our trusted information and putting that on the website for the public to go there. So we're in good shape.
John, I've personally seen you in action, and it's very comforting to know that you are here in East Brunswick, and you've been here for so many years.
Yeah, has been.
And you give 100% of every fiber of your being to helping this community, and you've done so for so many years, and I just want to thank you so much for everything that you have done and you continue to do.
Thank you.
To help keep us healthy and safe.
Thank you.
Thank you. Any last minute or parting thoughts for our viewers?
I think we've given a lot of information out.
Yeah, I just want the viewers to know we're going to be okay. We're going to be okay. This is why we're here. This is what we do. This is what we do. And if you have any questions at all, contact us. Contact our offices, and we'd be more than happy to do a one-on-one with you. Just remain calm. Everything's going to be fine. We're on this.
What's the best number to contact you at, John, if somebody does have a question for you?
So you can go through our website anytime, eastbrunswick.org, or my phone number direct, 732-390-6947. It's 24/7. It forwards to my cell phone. If it goes to voicemail, I'll get right back to you. So just call anytime.
Thank you, John.
Thank you.
Austin Kosik, Emergency Management
Yes.
Director. Les Jones, Director of Health Services for the Middlesex County, and Dr. Zivin-Tutela. Thank you so much for being here tonight to share your time and your expertise with us. Because the more information, reliable information that's out there, as John said, the better we're prepared to be able to handle this. And there's one other thing that I want to remind our viewers, as I always end each segment of the Advisory Health Council's Wellness Spotlight, that in addition to all this great information, not everybody that contracts the coronavirus dies. One of the most important things is the healthier you are, the stronger you are to be able to resist the effects of this and any other malady or condition that may affect us. Because wellness works when you work it.